first started teaching, I can remember how nervous I was. One of the biggest concerns I had was, what if a student asked me a question and I don't know the answer? How many of you can relate to that feeling? All right, so I'm sure that if I could see you, there would be some hands raised. Go ahead and put in the comments if that's you, if you can resonate and relate to that experience. This is what I quickly found out, not only from great mentors, but also just from good old-fashioned experience, is that oftentimes my ability to engage in a discussion with students about any muddy points that they have, that's going to go a long way as it relates to not only my ability to grow and develop as a nurse educator, but also to help students comprehend concepts. One of the biggest questions and most important questions that we can ask in the classroom is, tell me more about that. Can you share more details, or can you tell me the why or tell me the how? So just asking those Socratic, open-ended questions really helps us have a deeper comprehension of concepts. And it also helps us better know exactly where our students' muddy points are. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educator colleagues on their journey to nurse educator excellence, achieving CNE success on the exam, or maybe you're on the journey to achieve CHESI certification. Whatever your path is that has led you here to Dr. Sellars Educate, we are happy that you are here. Now, there are 2 steps. If you're returning, you already know that you want to take showing up for our YouTube snapshots. Number 1 is to print out the study worksheet that's listed right here in the description. The second step is to pull out Billings and Halstead. 6th edition is the textbook we're using right now, but if you have the 7th edition, you can use that one as well. You're going to see the crosswalk that is published by Elsevier, and they shared a copy with us. We're grateful for that, to allow you to go to the exact page numbers in 7th edition that is going to align with the content that we are discussing. All right, so let's go back to talking about our initial content related to how do we ensure that we are integrating the really important pieces that we need to in order for us, first of all, to meet our learning objectives for that learning interaction that we have developed for our students. And then second of all, we want to make sure that we spend some time developing that lesson plan, right? Because we don't want to go in and just have information that we are sharing with them that is not relevant or not aligned. We want to ensure that we have mapped out that teaching plan, that lesson plan that's going to help guide us in our discussion that we are having with our students. That's exactly what we do here at Dr. Sellars Educate. We spend time developing curriculum, developing content that's going to be meaningful as you move forward on your journey. All right, so first we're going to go ahead and go to our Canva presentation related to our question today, which is 70% CNE success rate. So first of all, we want to celebrate that NLM reported in September 2024 that there has been an increase in the success rate. Now, we aren't too incredibly excited because our goal is to help 100% of nurse educator colleagues achieve success. Right now, we usually vacillate between 98 to 100%. Sometimes we get to 97. When following our 7-week study plan or our 60-day plan to CNE success. So here are questions that we are asking you during this snapshot. Who, what, when, why, and how? We want you to think about these 5 very important open-ended questions that's going to help you dig deeper into your comprehension of concepts related to integration. Okay, so that's the next step that we're taking. The first step that we talked about in the previous snapshot was really looking at application. We already know that 70 to 80% of the exam questions on the CNE exam are at that application and analysis level. And we know also that integration is a really important part of the journey that you are moving forward on as you consider your next steps towards CNE. So now we want you to take some time to reflect. We want you to ask yourself, who, first of all, am I focusing on when I'm developing my content? Is it the patient? Is it the student? Is it me as the faculty member? Who is my primary stakeholder that I'm focusing on as I'm developing my content that I'm integrating based on what the evidence says I'm integrating those evidence-based teaching strategies, evaluation strategies that are going to help close the loop for my students and move them forward on their journey towards exam success, discussion success, NCLEX success, and ultimately patient care success. Here's the next question I want you to reflect on. What? So what is it that I know about my learners? How have I gathered that data, that information about who my learners are, perhaps how they learn best? And then here's another what question. What are my objectives? What is it that I want my students to walk away with having a better understanding after we have engaged in this highly impactful, engaging discussion, engaging interaction that I have developed for them in their classroom experiences, in their skills lab experiences, sim lab experiences, or their clinical experiences. This also aligns with our topic of CNE success. Go back, if you haven't already, print out that CNE Clinical, CNE Novice Candidate Handbook, whichever exam you're taking, and then you want to look at that detailed test blueprint. Where are you today? Where are your gaps? You want to do that self-assessment, looking at all of those sub-competency statements or knowledge statements as described by NLN. Where are you today? If you're not at that 80% threshold, we want you to circle, put an asterisk or star that specific content area. And then we want to help you on that 7-week journey, on that 60-day journey to ensure that you're closing your knowledge gaps. We are happy to support you as you move forward. You can go to our website, drselllarseducate.com, and you'll find a resource to help you with that 7-week study plan or that 60-day study plan. Here's another question you want to consider. What questions are on the exam? And how have I mapped it or aligned it with the content that I'm actually teaching in my course? I know this is a lot to reflect on, and this is a little bit different of a format. We want you, now that you printed out that study worksheet for our time together today, we want you to write down and reflect on these 2 categories of who and what. Now, we're not going to go through all 5 of those questions that we initially started with, but these are 2 really good ones to help you dig deeper into your knowledge areas as it relates to integration. Motivation gets you started. Habit keeps you going, and discipline keeps you growing. This was a quote that we talked about when we explored application. So application is a key to success. That's where we started. And now we have leveled up, right? We've leveled up to integration. You now understand how we apply the concepts and really why we apply these concepts in our everyday teaching strategies with our students. Now we want to talk about integration. How do we integrate? Why do we integrate? And how do we integrate? This was a quote from a coach that focuses on discipline, the value of discipline. So just take a second to think about what enticed you to show up today. What was your motivation? What was that trigger that helped you make a decision about how you were going to spend your 10, 15 minutes with us today? Okay, so I want you to reflect on that when you get stuck on your journey. And then habit. We know some literature says it takes 15 days, it takes 21 days to develop a habit, but that's not you, right? You're going to develop a habit starting today with showing up for yourself, with investing in yourself to become a better nurse educator. Just 1% every day is our goal, to become better than we were yesterday. And then discipline, putting it on your calendar. For me, if it's not on my calendar, it does not happen. Okay, so what about you? Is that your story too? We want you to put time on your calendar where you're dedicating to moving forward on your journey. 70% is that success rate as reported by NLN, 74 for CNE Clinical, 84 for CNE Novice. We don't want you wasting time and resources. That's why you're here, right? That's why you are reviewing content that's evidence-based in order to provide the best learning experience for our students and to also help our students be equipped with sound clinical practices, sound knowledge related to the practice decisions that they're going to make every day. We're here to bridge that theory practice gap. We have to integrate these evidence-based practice to do that effectively. This is a nice segue, right? Talking about integration, safe patient care practices. Clinical judgment is next. How knowledgeable are you about Tanner's clinical judgment model? Or it could be the NCSBN clinical judgment model. There's about 3 now in the literature that are all evidence-based. If it's not a familiar area for you, I encourage you to take a look at Tanner's model. You can see the citation here, so feel free to print out her resource and read through it. Even though it was published in 2006, we know that it's still very relevant to the work that we do today. Bloom's taxonomy, I want you to take a look. This is going to be pages 188 through 190. And I want you to take 2 steps today. Okay, so write this on your study worksheet. Number 1, I want you to draw your pyramid. And I want you to fill in the blank. Okay, I want you to fill in the blank in 2 areas. Number 1, I just want you to write down the 6 different levels of Bloom's taxonomy. You can see this is the Vanderbilt model. We like this one, so this is why we're sharing it. They allow educators to use it. You don't have to have permission from them, which is great. And then the second step I want you to take just for today, okay, is to write down the definition. Now, when you become more advanced on your journey, then you want to write down the verbs. You want to map them to learning objectives. You want to map them to your teaching strategies, your evaluation strategies. But just for today, we only want you to map it to or to include content using your triangle that has the 6 verbs on each level and the definition, okay? And then next, what we want you to think about is how do these levels for Bloom's taxonomy, just the cognitive learning domain, how does the teaching strategies, how do those teaching strategies that you align with your teaching plan show up in your classroom? Let me give you an example. All right, so let's take, in the spirit of our discussion today, analyze. Okay, so if you're analyzing, we know you're drawing connections amongst ideas. If a student is struggling with understanding blood flow through the heart, how am I analyzing that information? How am I helping students differentiate the blood flow through the right valve versus the left valve of the heart? Okay, so again, it's drawing connections amongst ideas. Next, what we want you to think about is the thought-provoking question. All right, so before we go there, we're going to stop sharing this screen and we're going to flip over to Prezi, because I want you to take some time to kind of recap what we've discussed. Okay, so first and foremost, let's go back and take a look at what we mentioned during our time together today, how we first started. So this is a consideration that you may want to think about as you're moving forward on your journey as well. So we started with our conversation about who, what, when, why, and how. Okay, so you've written down now on your study worksheet how these questions really show up on your journey towards CNE or CHESI success. And then second of all, what's going to be your next step to integrate, once you answer these questions, the evidence-based practices that we have talked about. It's not enough to be at that lowest level of the cognitive learning domain. Who can put in the comments for us? Hopefully you all are watching this when it's launched, but if not, that's okay. We still want you to go ahead and put in the comments which specific learning domain or which level of the learning domain is that lowest level for cognitive, okay? And then the second step we want you to take is to write down pages 188 through 190 in Billings and Halstead. That's what's going to help you close your knowledge gaps as you move forward on your journey. This Bloom's taxonomy is such an important part of our how and our why. It's our what too, but it's our how and our why when we think about how we are going to move forward in integration. All right, so now we're at our thought-provoking question. So here's the question. You are preparing a lesson plan for nursing students to integrate theoretical knowledge of pharmacology with clinical practice. Which of the following strategies is going to best demonstrate integration level learning based on Bloom's taxonomy? All right, so next you want to think about these 3 options. This is a great way if you're considering how to best engage your students. It's unfolding content in a presentation slide, okay? If at all possible, highly encourage you to do that. It allows us to focus on only the content that is on the screen at the time versus reading along, right? We can't control how fast students read unless we control the content that we are providing to them. So A is ask students to define the pharmacokinetics of a specific medication. B is, I keep going backwards. B is have students memorize the classifications of commonly used medications. And C is provide a case study where students must select and justify medications. All right, so you can see these three options. We want to follow our two-step process. Number one is you want to think about, what is this question really asking me? We can see here that there's a stem, and in this stem, we have a statement. And then the second part of the stem is that we have a question. Okay. And then the second question you want to consider asking yourself is, what is it that I know for sure about content that is being asked of me in this question? Okay. So what is it that I know about Bloom's taxonomy? Have you drawn your triangle? All right. And have you drawn connections between the strategies, those teaching strategies, evaluation strategies that you're integrating in the classroom? And how do they show up on Bloom's taxonomy for the cognitive learning domain? Okay, so those are some considerations that you want to think about. And then last but not least, we want to go back to reflecting. Okay, so before we take a look at the correct answer, we want to go back to reflecting. Okay, so I'm going to share my screen again. Now that you've taken some time to kind of think through that thought-provoking question, now I want you to go back and reflect on where we started. Okay, so again, who is it that you're focusing on when you're developing your content? And then the second question is what? What do you know about your learners? Learning Styles Inventory, by the way, or LSI, is a great tool to use. It's free on the internet, where you can ask students to complete it and they can do a self-assessment. That's what they're doing on how they learn best. Now, this is what we know about learning styles. It's not one size fits all. It's not one way is the only way, right? We all learn in a variety of different ways. And the next question we asked ourselves is what? What are your objectives? Okay. And then what questions are on the exam? Have you mapped them already? And if you haven't, we want to make sure that we follow that as the first step, right, in developing valid and reliable exams, is mapping our blueprint. The how is what you want to consider as well. And if you chose C, you are correct. Providing a case study where students must select and justify medication administration is going to be the best strategy to demonstrate integration. We want students to engage in high impact learning strategies, right? And our ability to do that is we have to be knowledgeable about exactly what those are and how they align with learning theory and ultimately our learning objectives and those exam questions or those evaluation strategies that we're using to validate that learning has actually happened. So let's take a look at these two other options. All right, so I'm going to switch over because I do like Prezi because it's side by side, but at the same time, let me stop sharing this one. Sometimes it can also create confusion. So hopefully you all are staying with me. I want to go back to the best answer, which we just said is going to be C. Okay, so let's talk about the other two options. All right, so A, we said, ask the students to define the pharmacokinetics of a specific medication. Well, when we think about integration, that's more that when we ask them to define or to describe the pharmacological influences or impact of a medication, that's more at that lowest level, okay? It can go up to that second level, but ideally it's not at that upper level, that upper third of the pyramid, I like to say, or taxonomy, which is integration. Okay, so yes, we're going to be able to validate that students are knowledgeable about the pharmacological effects of medication. However, when we really want to engage in that integration, the student's ability to apply the concepts to make decisions about the knowledge that they have or given the knowledge that they have, that's when we're tapping into that higher level of integration. All right, and then we had B as an option, which was having students memorize the classifications of commonly used medication. You can put in the comment section which specific taxonomy level is this most aligned with. All right, so I'll give you all a second again for B, which specific taxonomy level is having students memorize most closely aligned with. You can look at page 188 in Billings and Halstead, 6th edition if you're not sure. I'll go back to our presentation slides where we talked about Bloom's taxonomy and the different levels. All right, and then C, we know that case study does allow integration and allow students to really process the concepts that they understand as it relates to the pharmacological influences of medication and the impact it has on patient care. And then they're able to justify, right? Going back to that why. going back to how, even sometimes going back to what happens in the body when we actually are giving a certain medication. All right, so that is going to help you close your knowledge gaps as you think about how you're going to best prepare for the exam and ultimately how you're going to become a better nurse educator every single day. That is our goal, is that every single day you're able to integrate these evidence-based practices in a way that's going to scaffold your learning over time, just like we do with our students, and ultimately advance your knowledge so that you're more competent and confident in your ability to engage students in the learning process. So this is what we want you to do as our last tip before we close out our time together today. We want you to write down what attracted you to those incorrect options. Okay, so if you didn't choose C, we don't want you to get upset about it, right? Here's the good news. We don't write questions for the CNE exams, okay? We simply want to engage in thought-provoking questions that will allow you to pause and to better understand the rationale for the incorrect and correct options. Okay, so that's what we want you to write down. What attracted you to A or B if you did not choose C? The next step we want you to take, and the last step, is we want you to do a little bit of a self-assessment. So what's your score out of 5? 5 meaning that you are at a point where you are very knowledgeable about the content, and 1, you are very confused. Okay, so 1, you're very confused, 5, you're very knowledgeable. And then if you're in that sweet spot of 3, that's a great place to be, because that really validates for you that you have a little bit more clarity to seek related to the concepts we've talked about. How do you clarify and clear up your muddy points? Well, first, we want you to start with the right references. I know it can be tempting, and sometimes you are told to use different references, but this is what we know. Based on colleagues, hundreds of colleagues that we have surveyed across the country, you only need these 2 textbooks. Billings and Halstead, you're going to focus on Unit 3, which is chapters 10 and 14. And then Dr. Caputi, we're still in chapter 1 and 2. And if you have our study workbook, this is going to be a great resource to help you, again, not waste time and not waste money. You're able to hone in with specific content areas in our study workbook, parts 1 and 2, to help you close your knowledge gaps. And it's exactly that. It's a workbook, right? So you're putting pen to paper. You can print it out as a PDF. It's available to you to print out. Or if you want a hard copy, we can ship that to you as well. The only way that you will not achieve success on the CNE exam is if you quit. We are here to support you on your journey until you are successful, no matter how long that takes. And we know with colleagues, it can take a different amount of time, right? Depending on what happens in life. And we know that life gets in the way. We know that so many of you have lots of things going on, especially depending on the time of the semester that you're watching the snapshot. So just remember that we are here to support you. Reach out to us, info@drsellarseducate.com. And we look forward to seeing you in our next snapshot. Have a great one, everybody.